Hello to everyone. Today I'm dealing with the topic screening and assessment of high risk pregnancy. Myself Anitha, nursing tutor, ES College of Nursing, Villupuram. So, some overviews about the high risk pregnancy. The pregnancy is a crucial thing the mother should have in her lifespan. In every pregnancy, the fetus, mother, or neonate having an increased risk of morbidity or mortality on before or after delivery. Pregnancy places additional physical and emotional stress on a woman's body. Health problems that occur before a woman becomes a pregnancy or during pregnancy may also increases the likelihood for high risk pregnancy. So, screening and assessment of high risk pregnancy. That what is screening? Screening is defined as a purpose of identifying apparently healthy people who may be an increased risk of a disease or condition. Okay, so who are all comes under the high risk pregnancy? High risk pregnancy is defined as a pregnancy in which the mother, fetus, or newborn are at increased risk of morbidity or mortality during pregnancy, labor, or puerperium due to some complicating factors. So, here the warning signs of immediate visit to the doctor or health facilities or fever more than 24 hours, headache, blurring of vision, generalized swelling of the body and puffiness of the faces, palpitation, easy fatigability and breathlessness at rest, pain in the abdomen, vaginal bleeding or any watery discharge during the pregnancy that should need an immediate visit to the doctor or a health facilities that is near to the mother. Here the high risk conditions that not to be missed for the pregnancy. Severe anemia, that is hemoglobin is less than 7 mg per dl, pregnancy induced hypertension, preeclampsia, syphilis, HIV positive, gestational diabetic mellitus, hypothyroidism, young preemie, that is less than 20 years old mother or elderly gravida more than 35 years mother, twin or multiple pregnancy. These are all the conditions that should not be missed at any stage. They are considered as a high risk pregnancies. So here are some of the high risk screening. So all the pregnancy at the initial screening, history taking, maternal age, in that history, maternal age, reproductive history, in the history of anemia, history of medical and surgical disorders, any history of cardiac diseases, history of viral hepatitis, family history of communicable or any non-communicable or any pregnancy related disorders, socioeconomic status, multiple pregnancy, congenital malformation and previous operation, previous surgical history should be collected at the time of initial screening of the pregnancy during the confirmation. After collecting the history, there should be an examination. So here the general physical examination and the antenatal examination. In the general physical examination, height, weight, BMI, medical condition and head to foot assessment. This and all comes under the general physical examination. And antenatal examination, uterine size, shape and abnormalities in the uterus like genital prolapse, laceration or dilatation of the cervix, tumor or pelvic inadequacy. During a labor, premature rupture of membrane, prolonged labor, hand, feet or cord prolapse, PPH, that is postpartum hemorrhage, puerperal fever or puerperal sepsis, abnormal presentation, obstructed labor, and during the after delivery or during the newborn. For the newborn, APGAR score below 7, birth weight less than 2.5 kg or more than 4 kg, convulsions, respiratory distress syndrome, hypoglycemia, fetal infection, anemia, major congenital abnormalities and jaundice for the newborn. These are all the things that should be considered for the newborn as a high risk. Next one is diagnostic test to find out the high risk pregnancy. This is a test to establish the presence or absence of diseases as a basic for treatment decision in symptomatic or screen positive individual. That is, it is a confirmatory test that should be done only for the mother who is having symptoms. So diagnostic test for the high risk pregnancy is of two types. One is invasive and another one is non-invasive. So non-invasive in the sense of mother does not feel any pain during the procedure. So invasive in the sense mother having a pain, mild to severe pain during a diagnostic testing. Non-invasive diagnostic testings are fetal ultrasound or ultrasonic testing. Fetal ultrasound is a test during a pregnancy that uses reflected sound waves to produce a picture of a fetus in a camera or a chip. Organ that nourishes a fetus and the liquid that surrounds a fetus that can be displayed on TV screen. That may be saved as a part of the baby's record. Look at the picture. This is a camera thing, GIF that is done during the USC. What we can find by checking the USC, that is ultrasonography, or in the 3 trimester. First trimester fetal ultrasound is done to determine how the pregnancy is progressing. Find out the pregnancy with more than one fetus. Estimate the age of fetal age, so that is a gestational age of the fetus. Estimate the risk of chromosome defect such as Down syndrome. Check out the birth defect that affects the brain or spinal cord. That should be found out during the first trimester scan, that is first 3-month scans. Next is second trimester fetal ultrasound is done to estimate the gestational age. Look at the position, size of the fetus and placenta and amniotic fluids, and determine the position of the fetus, umbilical cord and placenta during a procedure such as an amniocentesis or umbilical cord blood sampling. Detect the major birth defects such as the neural tube defect or heart problems for the fetus. In third trimester, the UOG is done to make sure that the fetus is alive and moving. Look at the size and position of the fetus, placenta and amniotic fluids. Next one is cardiotogography. Here CTG is a technically means of recording. Graphy means recording and the fetal heartbeat. Cardio means fetal heartbeat. Togo means uterine contraction. Cardiotogography is done during the pregnancy, typically in the 3rd trimester, more commonly known as electronic fetal monitoring, EFM. Interpretation, what is the thing that should be interpreted by the use of CTG means uterine activity, that is contraction, baseline fetal heart rate and baseline fetal heart rate variability. That is any variabilities of the fetal heart rate that should be found with the use of CTGs. Next one is non-stress test. A non-stress test is a common prenatal test used to check on a fetus health. NST, also known as a fetal heart rate monitoring, it is usually done after 26 weeks of pregnancy. Certain NST results indicates that the mother and fetus need further monitoring and testing or a special care. Here the NST with mother. Contraction stress test. So this is named as CST. Contraction stress test is performed near the end of the pregnancy to determine how well the fetus will cope with the contraction of childbirth. So that is a slight difference between the CST and NST. So NST is a non-stress test and CST is a contraction stress test. So NST is a non-invasive procedure. The mother does not feel any pain, but contraction stress test, if mother is feeling mild pain because the mother in having a contraction during the CST. In NST there is a high false positive rate, but CST fewer false positive rate. For NST, no maternal or fetal risk. For CST can put stress on the baby and may be contraindicated for some women. If what is a normal NST means 2 acceleration in 20 minutes. What is a normal CST means 3 contraction in 10 minutes. What is the abnormal things noted in the NST means non-reactive, does not have at least 2 acceleration in 20 minutes. What is the thing noted in the abnormal notation in CST is positive of deceleration. Fetus is enabled to safely handle the contraction. Next one is invasive diagnostic test. So the mother feel mild, moderate to severe pain during the contraction. During the diagnostic testing. First one is chorionic villi sampling. So what is chorionic villi? Chorionic villi is a structure, small tiny blood vessels which is connected between the placenta to the fetus. Okay, it is a small structure in the placenta that act like a blood vessels. These structures contain cells from the developing fetus. A test that removes a sample of these cells through a needle is called chorionic villi sampling. Chorionic villi sampling is a prenatal diagnosis to determine chromosomal or genetic disorders in the fetus. Chorionic villi sampling usually takes place at 10 to 12 weeks of gestation, earlier than the amniocentesis or percutaneous umbilical cord blood sampling. It is preferred technique before 15 weeks. Next one is amniocentesis. And what is amniocentesis? It is a test that can be done during pregnancy to look for birth defect and genetic problems in the developing baby. Amniocentesis removes a small amount of fluid from the sacs around the baby in the womb. Womb means uterus. It is often done in the medical centers. Amniocentesis, it is not a diagnostic and it is not a screening test. It is a diagnostic test and 99% of accurate for diagnosing a Down syndrome, usually done between 14 and 20 weeks. Amniocentesis can be used to diagnose many different gene and chromosome problems in the baby, including anencephaly. Look at the picture, this is anencephaly. Down syndrome, rare and metabolic disorders that are passed down through the families, and other genetic abnormalities like trisomy 18. Embryoscopy. Embryoscopy is an examination of the embryo at 9 to 10 weeks gestation through the intact membrane by introducing an endoscope into the ectocolomic, that is extra embryonic part of the body cavity space by the transcervical or transabnormal manner. This is likely to remain confined to the management of early pregnancy in selected family affected by recurrent genetic syndromes with recognizable external fetal abnormalities. The procedure-related risk of fetal losses is around 12%. Next one is percutaneous umbilical cord sampling. So it is a blood sampling or cordosynthesis because the blood is taken from the cord. So cordosynthesis, also sometimes called percutaneous umbilical cord blood sampling, PUBS. It is a diagnostic test that examines the blood from the fetus to detect the fetal abnormalities, and advanced imaging ultrasound determines the location where the umbilical cord insert into the placenta. Then the ultrasound guide, then tiny needle through the abdomen or uterine wall to the umbilical cord is inserted to the umbilical cord to retrieve a small amount of blood sample from the fetal body. The sample is sent to the laboratory for analysis and results are usually available within 72 hours. The procedure is similar to amniocentesis, except the objective is to retrieve the blood from the fetus versus amniotic fluid. In amniocentesis, we are retrieving amniotic fluid from the sac. In the cordosynthesis, we are retrieving blood from the cord. Cordosynthesis, it is usually done when the diagnostic information cannot be obtained through the amniocentesis, chorionic villi sampling, ultrasound, or the result of this test were inconclusive. Cordosynthesis is performed after 17 weeks into the pregnancy. It detects the chromosome abnormalities like Down syndrome and blood disorders like fetal hemolytic disease. So synthesis is done to diagnose the malformation of the fetus, fetal infection, that is toxoplasmosis or rubella, fetal platelet count in the mother, fetal anemia, isoimmunization. This is the time to conclude my topic. Till now we have discussed about, learn about the diagnosis and assessment of high risk pregnancy and what is diagnosis, what are the screening things that is done for the pregnancy, and also the what are the diagnostic tests, confirmatory tests that is done for the pregnancy we have discussed. Thank you.